so I walk in and my evaluator's in my way. Okay, so I walk in and BSI, my scene is safe. Mechanism of injury was motorcycle versus tree. I have one patient. I would like a medic called to this situation. And spinal precautions, yes, I'm going to ask my partner to go ahead and hold him in line and don't let go. So my partner's going to come over and hold in line and don't let go. All right, then I'm going to approach, and I'm going to say general impression is bad. My life threats, do I have any life threats? You have squirting blood coming out of his left forearm. Okay, I'm going to deal with that immediately. So I'm going to place the gauze on it, and I'm going to elevate, and I'm going to attempt to stop the bleeding. Does the bleeding stop? The bleeding does not stop. So I'm going to ask my partner to hold the gauze, or my patient if he's conscious, to hold that, and I'm going to apply a tourniquet.
Pencil.
Grab me the OPA. OPA always works. Oh, I got a pencil. We're good. Okay, and I'm going to tighten that, and I'm going to tighten, and then I'm going to secure it so that it doesn't move. And as my bleeding stopped? Yes, your bleeding has stopped. Okay, I'm going to go ahead and probably splint that arm if we can get a chance to do that so he doesn't move it around. Then I'm going to come back up here, and I'm going to continue what I was doing. Sir, can you hear me? My patient is moaning, so I can't put an OPA in. I might be wanting to put an NPA in, depends if he's got a patent airway. I'm listening for breathing. Does my patient have any breathing? Your patient is breathing 6 times a minute. 6 times a minute is inadequate, so I'm going to have somebody bag him with a BVM. I don't have to do it. That's all I have to do. I'm going to have somebody bag him with a BVM, 1 breath every 5 seconds. If they tell me he's breathing 12 times a minute, I'm going to put on a non-rebreather. Right? So I'm going to determine that. All right, then I'm going to check for pulses. Well, I'm not going to do it in the arm that I just put a tourniquet in, that's for sure. Checking for pulses, and pulses are weak. His skin, cool, pale, diaphoretic. My patient is going into shock. We're going to make sure that we put a blanket on him, transport immediately. I'm probably going to update my EMS that are coming and make sure that they know that this is a critical situation. And then I'm going to do my head to toe. I'm going to check to see if anybody can ask sample questions. If I have anybody, then I can get that information. Otherwise, checking ears, eyes, nose, mouth, checking the back of the neck, checking the front of the neck. My partner can probably stick a collar on, putting clavicles. Can you breathe? If somebody's bagging, I'm going to ask, breathe, 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 breathe. His ribs seem to be intact. Abdomen, 1, 2, 3, 4. I'm going to check down. His pelvis seems to be stable. Going to push in, going to push down. Sweep. His groin doesn't seem to be showing any indications of problems. I'm going to check his legs. I'm going to check for pulses. Sir, can you push? Can you pull? Even if he's unconscious, please ask. Can you push? Can you pull? Okay. I'm going to do his arms. I'm going to check to see if there's any breaks, any injuries other than the injury that we have. I'm not going to be able to ascertain if he has a pulse on that because I've eliminated his pulse. I'm going to check this arm here, see if he's got a pulse. Can you move your fingers? Can you grip? Good job. Okay, and then we're going to roll him over. So on your 3, 1, 2, he's heavy. I'm going to feel down his spine. Check. I'm going to listen, and then on your 3,
1, 2, 3.
I'm going to roll him back. I'm going to continue to assess him every 5 minutes because he's critical, and update my EMS, let them know that what they've got themselves coming on to, and I'm going to continually check my interventions to make sure that they remain interventions. Let's see. Oh, blood pressure. I'm going to get a blood pressure on this arm and his pulse and his respirations. What are they? Blah, blah, blah. Okay, I've got that. And I think we're good to go. What did I forget? Oh, tourniquet, yeah. Tourniquet time.
Is that a critical?
No.
Oh.
Is that a point on the tip? No.
No, it's not even a
Okay.
point. No, it's just what you should do. But I always forget. So, because personally, I'd rather try and stop bleeding with a pressure point than tourniquet.
Yeah.
Nasty looking arm.
Yeah.
Oh, that went through.
Well, at least he's got the right side. My other mannequin had 2 left
Motorcycle
arms. I have no idea.
That is a problem.
Very creepy. Very creepy. Okay. All right, so this one, you know, it's not difficult, it's just time consuming, and you just gotta be able to go from head to toe, okay? Remember, did you guys all memorize what I told you to memorize, which is the top half of that sheet? Cause that's the hard part. That's the hard part.
A lot better at it.
Good, okay.